I'm Jessica Real with jessicarealpt.com, which is my professional website and blog dedicated to pelvic health and wellness. Today, I am here with Jessica Drummond for what will be my first clinical expert interview in women's health, and I hope will be a series that I can continue for us as we continue over this year. So Jessica is the founder and CEO of the Integrative Women's Health Institute. Jessica has a really unique background in both women's health physical therapy, but also in clinical nutrition and health coaching. So I thought she would be the perfect person to come and talk with us today on nutrition and pelvic pain. So thanks for joining us today, Jessica.
Thanks so much for having me, Jessica. It's my pleasure.
So before we jump into talking about pelvic pain and nutrition, I was hoping you could share with our viewers a little bit about your background and how you came into this realm and this niche of nutrition and pelvic pain.
Yeah, well, it really started, as you mentioned, originally I was trained as a physical therapist, and I still do, practice and maintain my licensure as a physical therapist. And so, I started my career I originally started in orthopedics, sports medicine, but within about the first 2 years out of grad school, I specialized in women's health and, just kind of getting more and more specialized over the years, and worked at a women's hospital, worked at a big teaching hospital, and did all kinds of women's health, everything from labor and delivery kind of pain and postpartum pain, prenatal pain, pelvic pain, incontinence, fecal incontinence, urinary incontinence, just everything, breast cancer. We had women on high risk bed rest who were pregnant, cancer, female cancers in the hospital. So it was really the whole focus of my physical therapy career for years. And then I had a baby.
Yes, I've been there recently.
Yeah, and my first baby was born in 2003, so I now have a teenager. And fairly quickly after that, the truth is I had a hormonal crash, and I didn't even know what it was. I went to the doctor, had all this vague exhaustion and panic attacks, and I didn't sleep for a year at least, and it was just like horrible. And
some moms end up thinking are just normal things.
Yes. And essentially that's what I was told. And that's really what I thought too. I was like, oh yeah, you're supposed to be tired. I got sick all the time. I got mono, I had pneumonia. It was a rough recovery. And I had a pretty easy, healthy pregnancy, delivery, that was all fine. But the year or two after that was really rough, and it just kept getting progressively worse. I had terrible blood sugar imbalances, which I didn't understand at the time. I just, I had a lot of panic attacks basically. And I was exhausted. I was trying to do a new job. We by the way, had moved several times. We moved essentially every year from the year my daughter was born until like 2 years ago. So, I had a little stress, but I didn't think I was stressed. I was kind of used to just keep going, as a lot of women are. And so basically when I got no good answers, I was told to take antidepressants, which I tried, didn't help. And, take a nap, take a day off, or not really encouraged to take a day off most of the time. Right. And, I just kept getting sicker and sicker. So finally I had worked in Houston for a number of years, and there was a physician that we kind of sent all our difficult patients to there. And I just went to her and I was like, help me, what the heck's wrong with me? And she diagnosed me at the time, this was about 2006-ish, with adrenal fatigue. And we don't really call it that anymore. We kind of have a better understanding of it now. But basically my stress hormone system was a mess. And what really healed me was completely changing my diet and my lifestyle, which was interesting because I would have said that I had a healthy diet before that. I was
people think they do.
Yeah. I was eating a lot of vegetables. I never ate fast food, but I had a lot of work to do to really kind of get my diet in alignment with my genetics and my extreme schedule and my new baby and all this stuff. So, and in between, after I had my first daughter, I had about 4 years of secondary infertility. And so all of that kind of tied into my hormonal imbalances. And once I really understood what all of that meant, I realized that, a lot of our pelvic pain patients struggle with hormonal imbalances. So I brought kind of what I was learning in my own life to heal back to the physical therapy clinic. And I just really dove in from there. I went back and got a clinical nutrition certification. I'm about 6 months now, from even less, from finishing a doctorate in clinical nutrition.
Congratulations. That's a huge accomplishment.
Yes. And, it really, what I realized was no one in nutrition was really looking at this area, and physical therapists are one of the only subspecialties that really has a good handle on how to deal with pelvic pain, other than, occasionally like you need excision surgery sometimes and endometriosis or things like that. But we don't have any great medical options really. There's some hormone creams, there's some pain medication, but none of that really gets to the root cause of why a woman has pelvic pain. And functional nutrition combined with, the physical medicine of physical therapy, really, I found, and I've started publishing a bit of research on this, that gets finally to the root cause of some of these chronic pelvic pain and vulvovaginal pain in particular conditions.
Mm-hmm. That's awesome. It's interesting, and starting to think about nutrition and pelvic pain. I think a lot of patients, when we initially have that conversation and start talking about nutrition, I kind of will get kind of the eye roll of, yeah, but this can't really be that big of a deal for me. So can you talk a little bit about why does nutrition matter for someone who has pelvic pain?
Well, there's a couple of
topic.
Yeah, there's a couple of reasons that nutrition directly impacts pelvic pain. Number one is how you eat actually influences your hormonal balance. And so, for example, if you're very depleted of nutrients, so let's say your digestive function is off, you don't have great bowel movements, you maybe have heartburn, you maybe have been on proton pump inhibitors or reflux medication for years, you're not necessarily absorbing nutrients, even if you are eating a quote unquote, healthy diet. And if you're not adequately absorbing nutrients, you can't build hormones. So I see a lot of women, usually closer to menopause or sometimes postpartum, who are really hormonally depleted because they're either really exhausted, their schedule and their stress is intense, or they're just not absorbing nutrients, or they've been eating a very low-fat diet for a long time. Some of them are vegan and have been maybe exercising pretty intensely for a while. And so those particular kind of groups of inputs, when you're both kind of depleted and you're not nourishing yourself enough. And sometimes it's not even food you're not nourishing yourself enough with, but you're not having enough sort of pleasure, relaxation in your life, help, support. So these things on hormonal testing, we see really significant depletions in things like estrogen and testosterone, which have impacts on the pelvic floor muscles. And then also there's the issue of inflammation. So if you have systemic inflammation in your whole body, which can happen, if you're eating too much sugar or too much processed foods, or if you have food sensitivities. Most of the women that come into my practice have some food sensitivities to things like sugar or soy or dairy or gluten. Those are some of the most common. Eggs is a common one as well. Then you can have inflammation. And we know now that pain is always a decision made by the brain, essentially. But if you're putting if the brain is inflamed and the neurons, the kind of little parts of your brain that talk to each other, those get energy from mitochondria in the neurons. And if there's a lot of inflammation, those neurons don't function as well. And there's this kind of, you lower the threshold of what it takes to cause pain. So let's say you've got general inflammation, your brain is somewhat inflamed at a low level. I'm not talking about you've got like a headache or something, but it's this underlying biochemical inflammation. And let's say then you get a yeast infection, or you go on antibiotics, or something like this. And then you start to have symptoms in the vulvovaginal area that might trigger something like vulvodynia, and then you look at the gut. A lot of times if you have imbalances in the bacteria in the vulvovaginal canal, you'll most often have imbalances in the bacteria in the gut as well. So there's a lot of different ways that biochemically and physiologically, how you're eating, the stress in your life, sleep, directly can impact pelvic pain.
Yeah, that's so interesting. So it seems like women can have, or I guess men too, can have hormonal imbalances. And then you mentioned inflammation being big factors, but that tying into all of the other things that we're working on in terms of overall body relaxation, sleep hygiene, all those other factors. So if a person then has pelvic pain, what do you recommend typically? What would be their first step in helping with more of the nutritional aspect?
Yeah, so we usually start with, well, we assess digestive function.
Okay.
So are you eating, are you chewing? You know, the evidence-based number of times you should chew a bite of food. Can you guess what that might be?
Oh gosh, probably way more than, especially as a physical therapist sitting at my desk, it's like 2 bites. I'm
Right.
sure it's way more than that.
Yeah, it's like 40. Yeah, and at least 20. So that's slowing it way down, right? We have to see
what percentage of people actually do that. I'm sure it's really small.
Probably almost no one. I mean, very few. But, you know, if you don't adequately chew your food and you get essentially undigested chunks of food landing in your small intestines because you also don't have adequate stomach acid because maybe you're exhausted or you don't have enough nutrients, you may not have adequate digestive enzymes, then the food ends up in your stomach and the immune system reacts because it doesn't look like something that should be there. It's not in the form that the immune system recognizes. So chewing is a simple way to start. But then we look at that. Do you have enough stomach acid? Do you have enough digestive enzymes to actually digest your food? There's some testing we can do, but on an individual basis, one of the first things we do is what's called an elimination diet, because it's more the research gold standard than using like food sensitivity testing, because there's a lot of false negatives, false positives. They're not that reliable and can be kind of overwhelming. So I've developed a particular elimination diet for women with pelvic pain because we've looked at just all of the published case studies, all of the research that exists, and just from my clinical experience now in the last 6 years or so. And it's a pretty restrictive diet, but you only do it for 3 to 4 weeks. And we see what the impact is on your symptoms. You have to do it consistently. You have to be committed for about 3 weeks so that we can quiet the immune system. It takes that long to quiet down the immune system. But if you commit to that, also, you know, looking at your stress and are you over exercising, things like that, we can tell if you have any of the most common food sensitivities. And then, you know, we re-challenge and we take out things that are contributing symptoms. And so basically, as long as your digestive system is functioning and you're not eating foods on a daily basis or ever really that cause the immune system to react, those are really 2 important steps that get you started. And then as your digestion heals and you're eating plenty of healthy fats and lots of vitamins and minerals, you can start to rebuild your own hormones. You can start to build enough estrogen. You can start to build enough progesterone and testosterone. You can lower your levels of stress hormones. So getting the digestive system functioning allows you to set up this environment where you can heal the other kinds of systems that are often involved. And another interesting thing is, you know, a lot of my patients with pelvic pain have constipation or IBS.
Yes.
Because you've got that organ crosstalk. You know, the colon is really close to the vulvovaginal canal, the reproductive organs. So if you can fix digestive function, so this woman's not constipated and she's not struggling with IBS, which is a similar process really, that in and of itself helps to resolve the vulvar pain. Although most of the time women come to me primarily bothered by their vulvar pain and sort of used to like, oh, everyone in my family is constipated. You know, they're used to being constipated for years, but they're shocked when, as a sort of a side effect, the constipation resolves.
Yeah, awesome. So then the elimination diet, now, is that something, if I'm a patient listening to this right now who has pelvic pain, is that something that they should get in touch with you? And would it be through your health coaching, or do you have resources on your website or anything you could point them to for that?
Yeah, I think, you know, the best way to do it is with supervision so that we can really test and we can look at, you know, what kind of think about your genetics. Like, for example, one of the first case studies that we brought up and published, that patient was actually a vegetarian. So we had to be really, you know, deliberate with how we did the diet. Whereas another one that I'm working on right now, that patient had a blood type of O, which gives some indication that she'll do better with meat. So it's ideal to do it in context of a, you know, working with a nutritionist. But, eventually I will write a book, it will come out, but it's
look at your book and figure out exactly what they need to do.
Right. But it's long-term, it's easier to work with someone just because you'll get to those specifics faster.
That is, I think, true in lots of contexts, physical therapy wise too. And also I'm sure so you can help troubleshoot them along the way if something's not going well and adjust their program as needed too.
Yeah, because, it is not an exact science. Like I said, we don't have like a lab test that tells us exactly what is going to work here. So it's a constellation of factors that we really have to look at. And, it starts with the functioning of the digestion. Do they have there's other tests we can use to see, which nutrients are being absorbed. What do the bacteria look like in the colon? There are other things that can support that, but yeah, it's a little bit complicated. It's not something that you can sort of just, it's not a one size fits all diet plan at all. And, that's why I sort of struggle with things like the IC diet and the endo diet, those things, it's helpful. They're useful guides, but it really depends on the person, what the best kind of nutrition plan for them is. There's not a diet that aligns with a certain diagnosis that's going to work for everyone.
Mm-hmm. I find that so true with patients that I've treated with painful bladder. I see that, there's one person who can't eat anything on the list of foods, IC foods. And then there's this other person that may only find that certain foods irritate them. And so I think, it makes sense that everything would be so individualized.
Because, it's the same thing with the bladder, right? It's sort of like the digestion. You've got a lining there that can be irritated in different people. It's about inflammation. It's about the bacteria lining the bladder. So, those foods are useful guidelines in some cases, but sometimes that can actually be frustrating because people are like, oh, the diet didn't work for me.
Yeah.
It's not really a diet. It's like, here's some guidelines based on surveys. Let's look at your physiology and your genetics and the functioning. And this can change over time. Like some women may benefit, if let's say they have a buildup of estrogen and they're having, a lot of ovarian cysts. But so we focus maybe on a more kind of detoxing diet that supports liver's detoxification of estrogen. So that's going to be very high in vegetables, lower in meat, things like that. But that may not be the best plan for her to be on maybe when she's trying to conceive or when she's breastfeeding. So it's about the woman and the time in her life and what else is going on. There's not just one quote unquote diet.
Yeah, no, that totally makes sense. Now, I'm curious to get your thoughts on the topic of probiotics, because I think that it's a hot topic right now. I think I have patients come in and almost all of them have tried some type of probiotic. And I'll have patients come in and say, oh, probiotics didn't work for me. And they just went to Whole Foods or maybe even to CVS and just picked up something. So I wanted to get your thoughts on probiotics and what you thought, who benefits from probiotics? And if they do, how do we figure out what they should take?
Yeah, that's a great question. Almost impossible to answer. So here's the thing about probiotics. So there are, I don't even remember the number off the top of my head. It's like 10 to the 10th power of little bacteria guys who are living in your colon. It's so many more cells and genes than we have human cells and genes by orders of magnitude. So you can put in a capsule, I don't know, 100 billion, 200 billion at the outset. It's not even touching the number of organisms that is in your colon. Not to mention when you take them in a capsule, they have to get through the stomach acid and so forth. Now, that's not to say they're not helpful and effective, but we have to know a couple of things. Number one, is there like an overgrowth of yeast or pathogenic bacteria? Because in the normal kind of gut microbiome, that's this whole community, microbiota, this whole community of bacteria, yeast, viruses, fungi, all this stuff that live there. Some of them are bad dudes, some of them are pathogenic, some of them can cause yeast infections, but having those in small to modest amounts when they're balanced out by the healthier commensal bacteria is just fine. But if there's overgrowth, which we can only roughly measure, using symptoms, using some labs. And so you sometimes want to use some herbs to try to kill off the excessive bad bacteria, funguses, viruses, and so forth. And again, that's a little bit of a crapshoot, but there are different ways to do it. And then depending on what kind of issues you're having, which bacteria are overgrowing, there are so many different kinds of bacteria in probiotics. So, a lot of the studies are very general. They might look at, does XYZ probiotic work for constipation or for diarrhea? So there is a useful resource called Probiotics Advisor, which does kind of take all that data, and it's constantly updated. You can look it up. There's a fee for it, but it's not very expensive if you use it on a regular basis. And you can look up what's the latest data on which particular strains of bacteria help with, for example, constipation. And so there are some studies that have been done in some of that. For example, we know in pregnancy, a kind of multi-strain capsule with mostly lactobacillus and bifidobacteria, different strains, maybe a total of 6 to 8 strains, is fairly efficacious and safe in pregnancy. We know that there's I think there's 2 strains, Lactobacillus rudei and Lactobacillus fermentum, that are particularly useful in bacterial vaginosis and candidiasis or yeast infections. So the strain matters often. The quality certainly matters. Buying them at CVS, they're probably all dead, contaminated with gluten. Who knows? Maybe they're full of mercury from China. You want to get it from a company that's voluntarily inspected by the FDA. And, there's spore-forming probiotics now, which potentially pass through the digestion more unscathed. So there's lots of different kinds. And sometimes, honestly, just because the data we don't know. There's so much more that we don't know about this community of bacteria than that we do know, that, it's hard to just point to the shelf and say, take this brand, take this one. And you can consider everything we do, though, know, and make fairly educated guesses. And then put that in context with eating fermented foods. This is what people have done forever. A couple of interesting things I've seen in my practice is people tend to thrive more on fermented foods that are made in locations where they thrive, where they feel good. That interestingly could make sense that's the bacteria in those areas.
That is really
So I would start with eating sauerkraut. That's probably the best thing you can do. And if you have a bacterial overgrowth, now here's the other kind of edge of that coin. Another common challenge we have now is people struggling with small intestine bacterial overgrowth. Shouldn't be a huge population of these organisms in your small intestine. Most of them should live in the large intestine. When they back up into the small intestine for various reasons, low motility, problems with the sphincter, not enough stomach acid, then we have to, again, try to kill them off. And those people are going to feel super bloated if they take almost any probiotics, and even if they eat probiotic foods. So we have to get rid of the pathogenic, kind of tamp down the fermenting going on in the small intestine before we move forward.
Yeah, that is very, very interesting. So I think, I don't know, I see a lot of the blanket I tried probiotics and it didn't work, or, it just changes the context when you start really thinking about all the types of bacteria and where the problem really is existing. So I have a lot of my readers and listeners are patients, but I also have clinicians, both physical therapists and pelvic health, fitness professionals, other healthcare professionals listening in. So my next question then would be, if I am a physical therapist specializing in pelvic health, or a physician, what is your recommendation on where to start for them in terms of making nutrition recommendations for their patients with pelvic pain?
Well, certainly starting with the elimination diet, looking at their digestive function, are they having a good quality Bristol 4 bowel movement every day? Are they chewing? Are they eating under stress? Are they cramming down their lunch at their desk? Is their blood sugar stable? Are they eating, in a way that's kind of keeping them steady throughout the day, or they have to kind of walk around with power bars or candy bars without feeling, blood sugar crashes? So starting with just optimizing sort of generally the function of the digestion, shifting from a diet that's high in inflammation to even just starting with a whole foods like Mediterranean diet will be a step in the right direction. And then, we do have training programs for professionals. Yeah. So, I've got a webinar out there that's free. I can give you the link to that. And there's, we have deeper training programs as well. But that's where I would begin, get your clients eating in a relaxed way, get them enjoying food, have them not afraid of food, because even if they have some food sensitivities, being afraid of eating is worse than, eating gluten from time to time. It's important that people have a relaxed, kind of nourishing experience with food. And then when they can identify that something like gluten or dairy is a trigger for their pain, make sure you're supporting that with tons of other options. One of the things that happened to me when I was sick is a doctor put me on a gluten-free, dairy-free diet, which, to me now is sort of like, duh, everyone should pretty much be on a gluten-free, dairy-free diet. But at the time, it was extremely ridiculous. I was like, what? I'm Italian. I eat yogurt for breakfast and pasta pretty much the rest of the day. Like, what are you talking about? What am I going to eat? I was floored. I was so hungry the whole time. I was like, this is worse than the symptoms I was feeling. Mm-hmm. And so we have to remember that people are coming to this from very different places. So see where your clients are, move them towards, more vegetables, less sugar, less inflammatory foods. And then we can get to a point of really, in a clinical way, assessing which foods are ideal for them and which foods might be triggers for their pain. Even in the assessment process, almost all of my patients go through an experience where they really have to learn it from themselves, right? One of them, went to Europe and ate a bunch of bread. And I was like, go, enjoy it, try it. Let's see what happens. Totally flared up. And then she was like, okay, not doing that again. She stopped. And now she has control over this, right? She can be like, okay, I'm not going to do that. Another one just a couple of weeks ago was like, oh yeah, I was feeling great. Everything's awesome. And then I went to a birthday party and ate gluten, dairy, and sugar cake. And then I felt like horrible the whole next day. And I was like, but you didn't, then you just knew. And 2 days later, you felt fine again. You just needed a little bit of recovery. So we all have to kind of experience this in a supported way for it to really sink in and for people to not, become obsessive about it.
Mm-hmm. That's great. Yeah. I think that, knowledge is power on so many things for patients. And I think just having, and for all of us, I think having the awareness that something impacts your body, then suddenly now you have control to change it. And that's just hugely impactful. So tell me if I am a patient listening to this right now and I'm interested in doing health coaching with you, how would they go about getting involved in that?
Well, I can give you a link to our clinic. And essentially you would just fill out a form on that link, and it's a virtual clinic. So I work with clients literally all over the world. So send in, your information in that form. We'll meet for about 15 minutes just to make sure that it's a good fit, that I can help you. If not, I'll try to find someone to refer you to, see how it goes. And that's the way we start working with our patients.
Great. Awesome. Well, thank you so much for chatting with me today. And I know our viewers will really, really appreciate your insight. For the viewers, I am going to put Jessica's information below the video here. So you guys will all have that, as well as links to her programs for professionals and links for her patients. So I hope that you all enjoyed this video, and I look forward to future videos with you. Please continue to tune in to jessicarealpt.com for upcoming blogs, and feel free to follow me on the link that will be, I believe, to the left of your screen, right of your screen, somewhere around there, you'll see a link. So I hope everyone has a nice evening, and I look forward to hearing from you soon.
Thanks so much. Thanks for having me.